Hi everybody, thanks for coming along to our webinar today about work experience. So just to introduce myself, my name's Fiona and I work in the student recruitment team here at St George's, and I'm going to be presenting the session today. One of my colleagues, Jenny, will also be taking part today. She's going to help me answer some of your questions at the end. Do you want to say hi, Jenny?
Hello and welcome everyone. My name is Jenny. I'm also work as part of the student recruitment team at St George's, and I'll see you again at the end of the webinar where we'll be discussing some of your questions. So keep those questions coming in. Back to you, Fiona.
Fab, thanks, Jenny. So let's move on. So I'm just going to talk you through what we're going to be covering in the session. So I'm going to be talking initially just to give you a bit of an overview about St George's itself. So some of you might have heard of us, some of you may not have, so just to give you a bit of context around that. Then I'm going to be thinking a bit about work experience. So specifically, what types of work experiences are universities looking for healthcare courses and why they're looking for that experience. We're then going to be going on to think about, well, the importance of reflection and how that relates to work experience. And then at the end of the session, we're going to be thinking about what you can do now in the current situation to get work experience going forward. So we are aware that, you know, in terms of you, the audience, some of you may already have what you think is relevant work experience and some of you may not. So we're going to try and, I guess, address both aspects through this presentation. So first off, a little bit about St George's. So you can see a picture of the university entrance there. So St George's is a very unique institution. We are a specialist healthcare university, so we only teach medicine, healthcare and science courses. And we're unique in that we share a site with St George's Hospital, and we're the only university that does in the UK. So I think for our students, that's quite a unique thing. And certainly when students are you know, studying to become healthcare professionals in the future, you know, sharing a site and seeing the clinicians and patients throughout the time when you're studying, you know, is very valuable. So I'm going to talk to you a little bit about our history, our location, and also a little bit about student life as well. So St George's, you can see the picture on the left back in the olden days. So that's a picture of St George's, the hospital, which started life in central London in the 18th century. And you can see St George's in the present day on the right. So that's the university entrance. And you can also see the helipad of the hospital. So St George's Hospital is a major trauma centre. So patients get flown in from all over the place. And again, you know, if you're studying or you're a staff member at St George's University, then, you know, you might see and hear the helicopter on a regular basis. And again, it just serves to remind you, I guess, what you're working towards as a healthcare student. So again, it just helps to emphasize, I guess, the unique nature of St George's and what we offer students. So a little bit about our alumni. So you might have heard of John Hunter. So he's regarded as the father of modern surgery. So if you've also heard of the Hunterian Museum in central London, so that's a collection of his specimens. Lots of you have probably heard of Edward Jenner. So he was the pioneer of the smallpox vaccine many years ago. And actually his work kind of continues at St George's University currently. So we have an infection and immunity institute. And actually lots of the researchers at St George's are currently involved in, you know, the COVID-19 vaccine tests and, you know, the antibody tests as well. And you can find out more on our website about how, you know, our clinicians, lots of whom are teaching staff as well, and our students are actually helping out in the current pandemic. It's a really interesting read. And Henry Gray, again, you might have heard as well. So Gray's Anatomy, not just a TV show, it's also a famous medical textbook as well. And this just gives you a flavour of the courses that we offer at St George's. So although St George's started life as a medical school, we actually teach a range of healthcare courses at the moment. So you can see we offer medicine as a course for both undergraduates and people who have already done a degree programme. We offer a range of different healthcare courses and also science programmes as well. A little bit about Tooting. So the hospital moved to Tooting in the 1970s, and that's where we're currently based. So it's a pocket of southwest London, and it's quite a vibrant, fun area. If any of you have been there or know of the area, there's lots of independent shops and fun stuff going on. It's a diverse community, and I think it's quite a nice place to be a student. There's lots of, you know, useful shops, supermarkets around, so it's all you really need, I suppose, in terms of student life. But we're actually about 20 minutes on the tube into central London, so there is easy access to central London too if you want that. So a bit about student life at George's. So you can see here some of our students taking part in lots of different activities. Although we are a small institution, we have a really active student union. There's over 100 clubs and societies. People get involved in all sorts. And on site, we've got student union bar, music room, dance studio, things like that. And because we're part of the wider University of London, our students also have access to those facilities as well. Great. So now I'm going to move on to the main part of the presentation today. So we're going to be thinking a bit about work experience, what and why, and also some key skills and qualities that link into work experience. First and foremost, I guess if you didn't already know, work experience is often a key entry requirement for medicine and healthcare courses in the UK. So often it's listed as an entry requirement alongside, you know, GCSEs, A-levels, or other academic requirements, or admissions tests, for example, if you want to study medicine. So at this point, I'd like to launch a poll. So I'd really like to know if you feel, before we start, do you think that you already have some relevant work experience? So all this means is that a poll will appear on your screen with your mouse or your keypad if you're on a phone. You just need to complete that poll for me. But it will be really helpful for me just to get a sense of you, the audience. So I'm hoping that now you should be able to see that poll on your screen. So if you could complete that, I'll just give you a few seconds to do that. Okay, just waiting for a few more people to fill in. So there are 3 options: yes, no, and not sure. So I'll just give you a few more seconds to fill that in. Okay. Okay, that's interesting. I'm going to try and share the results with you now. So I'm going to close that poll. Okay, so 49% of you don't feel that you have any relevant work experience. 32% of you think you have, which is great, and 19% of you aren't sure. So that's really useful for me too. I'm just going to make a quick note of that. Just bear with me, because I'm going to be running a related poll later on. Okay, so for those of you who've already got work experience, I'm really hoping that the value from this session will be coming in thinking about reflecting and how you can make the most of your experience. 49% of you, again, hopefully towards the end, we'll be talking about what you can do now to get some experience. The 19% of you that aren't sure, hopefully the next section is going to be helpful for you. Okay. So if we move on with the presentation, thanks so much for completing that poll. It's just useful for me to get a sense of the audience, seeing as though I can't, talk to you at the moment. So thanks a lot for that. So thinking about what universities actually mean in terms of work experience, first and foremost, lots of people tend to think of, shadowing, especially for medicine. We often get a lot of queries and people think that they have to have shadowed a doctor for medicine, but it's really not the case. And I'm hoping in this section of the webinar, we'll be able to just tell you a bit about what can be relevant. Actually, it's a really wide range of things. So working in a care environment can be good. So that could be, for example, could be shadowing, but could also be working in a care home or hospice, things like that. Community work is also really valuable. So that might be, working with homeless people, working in a food bank, doing all the voluntary groups, what else? St. John Ambulance, lots of different types of things can be counted as community work. Working with children or teaching, so that's really valuable, and often I find, having spoken to lots of our student ambassadors about the experience that they've undertaken prior to university, lots of people have done things like mentoring younger kids at school, maybe teaching them and being a tutor for younger students. So lots of agencies employ older students to teach younger people different topics. That's really relevant. And lots of our ambassadors have done things like being swimming instructors or, gym instructors, so things like that. So there's lots of different things where you might be working with children, teaching them various things which could be relevant. Supporting family as well. So if you have family with particular healthcare needs, that can also be really relevant. And again, all these things I've spoken about, they're all about working with people in need of care. Okay, and I think that's a really nice broad definition for you to think about, because if you've been working with people who are in need of care of some respect, that could be older people, younger people, then it's going to be relevant. Okay, because obviously as a healthcare professional, you'll also be working with vulnerable people, so there's a really key link there. But part-time jobs and group sports can also be really relevant. And although they might not seem to be at first, it's because you might be developing or learning key skills and qualities that are relevant to your future career. So it's really important to have a broad mind, okay? And I'm going to be talking later on about, how you can make those links between experience that you already have and trying to, work out, is it something that might be relevant for your application, which it might be. And lastly, I just want to talk about some key FAQs. I guess lots of people have queries about work experience, so I just want to address some of these. So lots of people kind of ask, well, how much should I be getting? And the really annoying answer is as much as you can. Now, it's really important to clarify that actually all these types of experience is good, but we appreciate that it's going to be very hard for people to get this kind of experience going forward over the next few months. Okay, no one will expect you to do that. So just to clarify that as well. But having a wide range of experience is great. In terms of how much experience is good, again, as much as you can get. Okay. Yeah, so I'm going to move on to the next slide now. So why do universities ask for work experience and what can you gain from it? So first and foremost, universities want you to do work experience so that you have an insight into the healthcare career that you want to go into. Okay, so we want to know that you know what it's really like, and you should also know what it's really like before you make that commitment to study a course for, up to 5 years. Okay, so that insight is really key. So we want people to have a realistic idea of what it's like to work as a healthcare worker. If you've done some kind of care experience before and you've realised, actually, I don't like working with little kids, they're really annoying, or I don't like working with people who need a lot of help from me because I can't deal with that pressure and I don't enjoy it. I find, for example, the care home environment really depressing. That's fine, and it's great that you've learned that, but the key thing is that you've learned it before you make that commitment to study the course in healthcare. Okay, so we really want to see that people have an insight into the profession they want to go into through their work experience. In terms of what you can gain from your work experience, as well as that insight, you can also really show universities that you've demonstrated a commitment to finding out about what it's like to study a healthcare course and work in a particular profession. So if you've gone out of your way, you might have volunteered a couple of hours a week over a period of months, and you've made that commitment, you've taken time out of your social life, your academic life to do that, that's wonderful, because it shows to universities that you're a dedicated applicant who's really invested in this course and career. So key skills and qualities. So work experience can be a great way of showing universities that you've got the key skills and qualities that you need to work as a healthcare worker. And this is really where things like group sports and part-time jobs can come in, because although they might seem unrelated, if you're able to demonstrate that you've got key skills and qualities needed for healthcare workers through those, then they're very relevant forms of work experience. So these are some of the key skills and qualities that we're looking for at St. George's. So these are actually things that we're looking for specifically from our medicine applicants, but actually I think they're really important just for any healthcare worker. Okay, and again, this isn't an exhaustive list of things, but I think if you are wanting to study healthcare, then starting to think, well, first of all, do I have these skills and qualities? And secondly, how can I prove to universities and demonstrate that I have these? That's really what you need to be thinking about, and that's where work experience comes in, because like I say, work experience can be a great way of demonstrating that you're developing or have got these key skills. So I'm just going to go through some of them in slightly more detail, just so you can really see the links. So empathy is, I'm sure lots of you know what empathy is. So it's really about putting, yourself in the shoes of other people and having understanding of, what other people need, how they might be feeling, how they might respond to certain things. It's not sympathy, which is feeling sorry for people. It's a slightly different thing. And it's obviously a really key skill if you're working with vulnerable people in need of care, having an understanding of what they're going through and what they might need from you. But I also think you need to consider empathy alongside things like professional detachment as well. So, if you're working with patients who are very vulnerable and need your help, you're not their friend and you are a professional. So, you do need to keep that kind of level of professional detachment as well. So I always think it's useful just to think about that and kind of balance that out with empathy as well, and just see that there is a line there. So insight and integrity, these two are slightly different things. So integrity, I suppose, is really about knowing, I guess, on a basic level, about what's right and what's wrong in certain situations. Obviously, as a healthcare professional, then you're going to be, as we've noted, kind of working with vulnerable people. So being aware of professional codes of conduct, what you should do in certain situations, having an awareness of things like patient confidentialities is really key. Okay. An insight. Insight really just means having a deeper understanding of something. Okay. So it could be linked to empathy if you're thinking about your patients and thinking, well, why might they be acting the way they are, or why are they doing this? Okay. But it's also about having a deeper level of insight into yourself, potentially. It could be about recognizing, your motivations, what you need to do better in, what your strengths and weaknesses. And actually, it's quite closely linked to reflection, I think, which we'll go on to talk about in a minute. And initiative and resilience. So depending on your healthcare role, being able to make decisions quickly, take the initiative might be really key. So for example, for a paramedic frontline worker. Okay. And resilience is, potentially, I guess, linked to problem solving. If you're trying to solve a problem in a time pressured situation and it's not working, you're going to have to be creative about what you then do. Can you come up with another solution very quickly that might work? But resilience in a broader level might also just be about you and how you cope mentally with things. So working in healthcare can be, very stressful. It can be very difficult. You might be working with angry patients, patients who aren't going to recover, and just, if you're working in a hospital, working long hours might be quite stressful. It can be a very hard environment to work in. But actually, we want to know that, and you should kind of be thinking about, well, can I cope with that type of thing? Am I able to, do I have a good level of mental resilience? If I have a hard day, am I going to be able to go home and then, recuperate? Am I aware of what the type of things I can do to de-stress? Okay, so it's kind of around those type of things. Okay. And as I've said, the reason we're talking about these is because, lots of these type of skills you can gain through healthcare related work experience, working with people in need of care, but actually they can be gained through lots of other experiences as well. If you think about things like organization, teamwork, communication skills, you can get those type of skills and develop them in things like group sports, part-time jobs and things like that. So that's why I'm talking about these and just emphasizing that it's kind of down to you, the applicant, to make these links and then tell universities about why your work experience is relevant. Okay. So I mentioned that, that wasn't an exhaustive list of, key skills and qualities, and you might want to look up the NHS value, so the 6 Cs. You can probably see how some of these are quite related to the other key skills and qualities that we've spoken about. So do go in and look at those if you're interested. Okay, so now we're moving on to the importance of reflection. So just thinking about, I suppose, well, what is reflection? Why do I need to do it? And how do I do that? So in the first instance, essentially reflection is about looking back on an experience that you've had and kind of exploring and examining that. And it could be doing things like considering your actions at the time, why you did what you did, could you have done something better? Okay. In terms of why it's important, it's key because it's a chance for you to consider what you've learned from your work experience. And it's really important to emphasize that actually, work experience is not just about actually getting it done and that's it, you don't think about it anymore. The real value of it comes when you reflect on it and when you can articulate to universities what you've learned from it. So it's all about learning from your experiences. It's about linking what you've done to what universities are looking for. And also key is to use your work experience as evidence to universities that you possess those key skills and qualities. So it's not really enough for someone to come to interview for, say, medicine and say, I just list off their work experiences and just say, I've done this, I've done this, I've done that. You need to come and tell us about that, but also tell us what you've learned from that and then use that as evidence. One of my pet hates as someone who interviews for the medicine course at St. George's is when someone comes to interview and they really know what key skills are important, but they just kind of list them off. So they might say, oh, I've got good empathy skills, or I'm good at communicating. But that's all they say. They don't go on to say, and I can tell you about this because I had this experience and I had to do this, and that demonstrates that I have this key skill. And that's really what you need to be doing. It's all about giving that proof and evidence to universities. So how can you reflect? There's lots of key questions that you can use, kind of to use as a framework, and we'll be talking about that in a second. But also keeping a journal is really valuable, I think, and it's especially valuable to kind of make notes and kind of reflect on experiences that you've done at the time. So I'd really recommend doing that kind of going forward, or if you already have work experience and you haven't kind of processed it, thought about it actively, and written about it and what you learned from it, then I'd really encourage you to do that now, because it'll still be fresh in your memory now, hopefully. But as time goes on, you may have interviews for medicine, be applying later on, the details will go from your mind. So that's why it's so important to try and do things, reflect on things as soon as you've done them. So a really great way to reflect on your work experience is so what, now what? Okay. So what work experience have you done? What did you gain from this experience? And now what do you know about yourself that you didn't know before? So that's a really nice kind of basic 3 questions that you can use as a basis for reflecting on anything really. So just wanted to, I guess, give you an example of how someone might reflect. And this is someone who has a part-time job at a cafe. They're doing it for a few hours every Saturday. And what have they gained from that experience? Well, by reflecting on it, they've realised they've found out about how important time management is. They spent time with customers. They've learned some good skills, so food preparation skills. They've learned how to work as part of a team. So they realise that they've kind of they need to work on how they speak to angry customers and not let their frustration show. And I think that's important to point out, because actually it's fine to have realised that you're not very good at things when you do work experience. It's fine to realise that you need to work on stuff in the future. It's also fine to tell universities about this as well. So no university will expect someone to come to an interview and just be perfect and not need to learn anything else at all. And actually, if someone does that, then they're probably not going to be the best candidate, because everyone has stuff they need to work on. So it's fine to kind of articulate that to universities. One thing that might be useful to add in is, how will you work on that in the future and how will you develop that skill? Okay. So this person has also learned to ask for help, and they've learned how to share their ideas and listen to others share theirs, which is arguably a harder skill, so that they can help each other and their customers. Okay, so I think you can see there's some really valuable points here in terms of teamwork. So this person would just need to maybe articulate their ideas a little bit more, but there are certainly things that they can say that about, they've had this experience and they really had to work on their teamwork, and give that as evidence during an interview. So here's someone that's volunteered at a care home. So again, they've just given those key details. Again, it's important to note that actually the information listed under the what column, so like how long they did the experience for and how they did it and the name of the person in charge, that's actually still important information to get, because lots of universities do ask for proof of your work experience. So actually you do need to keep a record of that type of information, but the key point is that that's not what's important. The really valuable stuff comes from what you've learned. So if we just have a look and see what they have learned from their experience. So they've realised how important communication is between staff and residents. They've seen how the care home work together. They have learned about post-qualification training, but actually it's important to point out you can learn about that, not just through this experience, you can learn about that online. So they have realised that they need to adjust their communication depending on the situation. And they've showed initiative because they're speaking to lots of different staff members to make the most of their experience. Okay. An initiative, you may remember, is one of the key skills and qualities that we mentioned before. So actually you can see how by reflecting, this person has identified that they have been able to demonstrate what a key skill during their work experience. So this is what you really need to be doing. Like I say, it's all about drawing out the links between your work experience and the key skills that universities want and articulating that to universities. Okay, so at this point, I'd just like to run another poll, and I just really like to know if, reviewing what we've learnt, it would just be really interesting to see if the numbers are any different from the last time we asked the question. So reviewing what we've learnt, do you now think that you've got some relevant experience you can use in your application? Okay, because obviously we've talked about how lots of different things are relevant. So again, it would just be really useful to see what your thoughts on this as you, the audience. So just bear with me, I'm just going to launch this poll once again. Just give you a few seconds to fill that in. Okay. Just a few more seconds. I think everybody may have voted. So I'm just going to close that poll. Okay, and now I'm going to share the results with you. Okay, that's so interesting. So essentially, before, 32% of you said that you thought you had relevant work experience. Now 89% of you say that you do, which is absolutely amazing. I'm really pleased that your views have changed over this webinar and that you now feel that you have got that work experience. So that's fantastic. Thank you so much for sharing that. I can see that 6% of you still don't feel that you've got any work experience and 5% of you aren't sure. But I'm really hoping that the next section will kind of give you some ideas about what you can do about that. And thanks so much for sharing, everyone. That's really valuable information. Great. Okay. So moving on, we're going to really be focusing on, what can you do now in the current situation? Okay. So first and foremost, it's really important to emphasize that, universities do really appreciate that lots of you might be in a bit of a sticky situation at the moment. I know lots of you think that you already have relevant work experience, which is fantastic, but some of you don't. And we do appreciate that it's really tough at the moment. We know that lots of placements and potentially work experience that you have lined up might not be available anymore. So we totally get that is the situation. And universities will not expect you to be getting the types of things that we were looking at before. So in terms of care home, hospices, shadowing, it's really not going to be possible to shadow a health professional or possible to work in a care home or work with lots of vulnerable people over the next few months, and we totally understand that. So it's important to note as well so that the usual requirements for universities will be they're very likely to be relaxed. So for example, at St George's, we have a statement on our website saying well, I'll read it out to you if you just bear with me a second. So our admissions team have released a statement which essentially says, we've chosen to relax our work experience requirements for prospective applicants for our courses, which would normally require that type of experience for 2020 or 2021 entry. So despite the relaxed requirements, we still require our applicants to have an understanding of the realities of working as a healthcare professional and to show that they have the necessary skills and attributes to that chosen career. But obviously we've already spoken about, those skills and attributes that are required, and we have identified that actually you can get them in lots of different ways. Okay, so I'm really hoping that helps to kind of, answer that part of that question. And we're going to go on in a minute to talk about other ways in which you can gain an understanding of the realities of working as a healthcare professional. So, I think lots of universities will be in a very similar position. Not everyone will have put statements on their website necessarily, but, universities are going to have to be relaxed in terms of their work experience requirements. We can't assess people on the same basis as last year, okay? So I hope that helps to kind of, ease any concerns that you might have. Like I said, there are still opportunities that you can, think about get more insight into particular careers. So yeah, so we're going to talk about that in a moment. Okay.
Sorry to interrupt you, Fiona, but this slide is still showing the poll.
Okay. Thanks, Jenny. I'll sort that out in a moment. If you just bear with me, guys. Okay. Okay, everyone, just bear with me 1 second. Okay, I'm hoping you can see the right screen now. Okay. Fabulous. So let's continue. So, sorry, everyone, if you just bear with me 1 minute. Great. Okay. So as I was saying, there are still opportunities that you can, gain more insight into particular professions and so on. I'm going to just talk about that now. Okay. So online resources, I've mentioned before that a big part of, why universities want you to get work experience and why you should get work experience is to get that insight into, particular healthcare courses and pathways and what it's like working in the NHS. So important to emphasize that, you can get this through lots of different ways. There's so many online resources at the moment, and even, non-online resources, reading books written by healthcare workers about their experiences, about what it's like to work in a busy A&E department, about what it's like to work as a junior doctor are out there. Potentially looking at video interviews of professionals talking about what they do in their daily life. There's lots of different things that you can use. In fact, there's so many online resources that are available. I think it's quite important to be systematic about your approach. But certainly getting an insight into, what a healthcare worker does and what the NHS is like is something you can totally gain from online resources. So, I hope that puts your some of your minds at ease as well. Specifically, if you're interested in medicine, Brighton and Sussex Medical School have a virtual work experience platform, which is open to everybody. So I'd really encourage you to go and look at that. Also, again, for medicine, there's a new platform called Observe GP. That the Royal College of General Practitioners, so GPs, have recently launched at the end of April. And again, that can give you a real insight into the primary care team and the roles of the doctor and the people who work around them. Okay, so I really encourage you to go off, if you're interested in medicine, to go and look at those resources. On our website, St George's website, we have a page that's called How to Make Your Application Stand Out. And that gives you loads of ideas about different websites and different resources. And if you're interested in different careers, there's other resources listed there as well. So I'd really encourage you to go and have a look on that webpage and just get some more ideas. In terms of volunteering, so there may still be opportunities for you to volunteer as well in the current situation. As I mentioned, not in the same ways that you could before, but in different ways. So, but again, with volunteering, I think it's important to, that we understand that not everyone will be able to get volunteering experiences. It kind of firstly depends on what's available where you are, and also your capacity, of course. So, it may be that, you might be, struggling with juggling various bits and pieces at the moment, and you won't have time to. That's fine, obviously. But this is just to give you an idea, I suppose, if you do have that time. So as was always the case, some volunteering opportunities are only open for people who are 18 or over, and the NHS Responder Scheme is one of those schemes. So applications, if that applies to you, then the applications are currently closed. But if you keep an eye on the website, which is called Good SAM app, then that can give you an idea, and possibly applications will reopen in the future. Otherwise, I think it's really a case of looking to see what's around locally. So it might be that, there might be local groups around where you are who are involved in, delivering food and prescriptions and medicine and things to vulnerable people. And, definitely see if you can get involved there with contacting people. If you've had leaflets through the door, get in touch with the organisers to see if you can help. So I think it's really about seeing what you can do at a kind of a very local level, in the next couple of streets to support any of that. And I think, again, it's really important to be creative and think, well, what am I good at? Are there any particular skills that I can offer in community groups and kind of input into anything local that's going on? So it could be that you're involved in community work already, that may not be kind of happening in the same way anymore. But are there different things that you could do to get involved? Can you help to move things online? Again, as I say, it's about being creative and seeing where you can input locally and what's needed. It might be, for example, if you're really good with technology, you could think, well, is there a way that I could try and get in touch with local residents who may be elderly and don't have or aren't aware of how to set up, for example, virtual meeting platforms so that they can see their family, for example. Okay. I think there's definitely things out there, but I would definitely encourage you to look at a local level to see what's going on and how you can input there if you can. Again, in terms of volunteering, it's important to say that you should only be doing stuff if you're healthy, symptom-free, as I mentioned earlier, if you have that time to spare as well. I put school studies up here as well because I thought, it's likely, obviously if you're at school or college, then you're working in a very different way to the way that you have previously, and schools and teachers will be interacting with you in many different ways. But is there a way that you can kind of think about, well, what am I doing now? And is it demonstrating, am I developing any key skills and qualities that might be important? So certainly things like organization and problem solving might be things that you're having, skills that you're developing just through having to actually do your schoolwork. If you're doing presentations or projects with other students, how are you managing to do that virtually? And is that something that you can think about developing to showcase to universities, okay, to show that you've got certain key skills and qualities? So that might be something else to think about. And I put reflection on here as well because again, it's really important with anything you're doing, especially over the next few months, to try and reflect on it. And you should definitely do that with online resources or books you're reading and stuff like that as well. So what I would do, for example, is I'd be really detailed. I'd make a spreadsheet and then I kind of list all the online resources and books and stuff that I wanted to read. I'd put a tick against them, so I knew when I had read them or investigated them, and then I'd kind of leave a section for a reflective writing piece afterwards. So as soon as I looked at a particular resource, I would sit and write a bit about what I learned. Was there anything that surprised me? Was there anything I didn't know? And if you kind of do that as you go along, that's going to save you loads of time later on. Okay, so I'd encourage you to put that work in as you go along. Okay. So we're almost at the end of the session. Just wanted to, I guess, review what we learned. So we found out a bit about St. George's. In terms of work experience, what and why, I really hope the takeaway you've gotten is that lots of different things are important. And, so many different things can be relevant, but again, it's really up to you to make them relevant. And the way that you can figure out if things are relevant or not is to use that skill of reflection. Okay, and reflection is how you make those vital links between what you've done and the key skills and qualities that you need to be showcasing universities. Okay, and in terms of what's going on at the moment, we've acknowledged that actually, universities are very aware that people won't be able to get the same types of work experience going forward, and that the rules and the stipulations will be relaxed going forward, but there are also opportunities for you to do things as well potentially, and to certainly be using your time over the next few months, if you have any, to develop that insight about your particular career and course that you want to study going forward. Okay, so hopefully we're at the end of the session, but I'm hoping we will have some time for questions. Jenny, are there any questions that you want to tell us about?
Thanks, Fiona. Yes, we've had lots of questions in, so thanks everyone for sending in your questions. The first question I have is from Max, and he says, should I take a gap year so I can get some more work experience? What do you think, Fiona?
I think that some people might choose to take a gap year, but I would say, and if you do decide to take a gap year, then certainly getting more work experience throughout could be something that you would do, but I wouldn't necessarily advise all applicants to do that just because of the current situation. I think a decision to take a gap year is really personal. It might depend on lots of different things. It might be if you want to make in some money at the same time. So it's a very personal choice. I certainly wouldn't be advising all potential applicants to take a gap year, but I think if that's what you would like to do, anyway, and that works for you, then certainly, you know, during a gap year, getting more work experience is a very valuable thing to do for yourself. So yeah, have you got anything to add there, Jenny?
No, I think you've covered everything. That's great. Thank you, Fiona. We've got some more questions. We've got one from Emma, and says, I'm a guide volunteering with Rainbows and Brownies groups. Is this relevant work experience?
Great. So yeah, I think that's totally relevant work experience. So yeah, so Brownies and Guides, I don't know if you all know, so they're kind of like, you know, it's a kind of a weekly meetup for young girls who I think like between 7 and 13. So my daughter goes to Rainbows, actually, she's 5. But yeah, I think that's really valuable because you're probably helping people to reflect. Sorry, you're probably helping people, those young people, to have teaching them and organising activities for them and things like that. So I think that's you're probably doing lots of valuable things there. And again, it's all about reflecting. So again, I'd encourage you to reflect on that and really think about if there's any key skills and qualities that you've developed. So what might you have learned from working with young people? What's different about working with young people compared to older people? How might you need to communicate with them in a different way, for example? But that definitely sounds like valuable work experience to me.
Great. We have some more questions. We've got a little bit of time. So this is from Manisha. And Manisha says, how many hours of clinical work experience would you consider adequate to be able to effectively reflect upon?
That's a tricky one. And I think it really depends on what you've done. So, and like, for example, if someone has some shadowing experience, often, for example, with shadowing, you don't decide how long you do it for. You just kind of get given it and you take it because that's what's on offer. So I know that often shadowing experiences don't last very long. I think it's really important to reflect on whatever you have, and because, you know, you could do something for 5 days and it might not be very valuable in terms of what you learned, but if you might have done something else for 1 day and it might be valuable. So it really depends on what you did. You know, if it's clinical work experience, then I'd probably reflect on it, and then if you go at the end of it, well, actually, I don't think I learned very much, then maybe don't focus on that initially when you're talking to universities. I hope that makes sense.
Great. Thank you, Fiona. I have some more questions, so I'll keep going. We've got Sarah, who says, I had a lot of work experience planned, but now they're all cancelled. Can I mention this to the university when applying?
You could mention it. It's a bit of a difficult one because usually universities wouldn't take into account, for example, if someone has some work experience lined up and they come to interview and they say, oh, I'm going to do this, then you know, I would certainly think, as someone who interviews for a medicine course, I think, well, don't tell us about it then because you haven't done it. So you might want to mention it somewhere, I suppose, and say, you know, especially if it was something that you had arranged yourself. So you might want to mention it, but I wouldn't dwell on it too much, because unfortunately a lot of people are going to be in the same situation. So you might want to mention it, but again, if there's other stuff that you can talk about, and don't dwell on it too much, I think that would probably be what I would advise.
Yes, I would agree also, Fiona. It's important to acknowledge if you've set up some work experience at a hospital or something, and because of the situation we're in, it's been cancelled. But the main point is obviously to reflect and link the work experience that you've got, that you've had completed, and the research that you've done and your insight into it. I've got some more questions. If we've got a little bit of time, we're almost there, but we've got Nabia, who's saying, since we cannot do any work experience physically, does virtual work experience in these times have the same value?
Thanks for that question, Abia. So yeah, I think so. I mean, I mentioned already that, maybe you've asked this question before I got to that bit of the presentation, but you know, I mentioned the virtual work experience from Brighton and Sussex Medical School. I certainly think, yeah, do go investigate that. I mean, as I mentioned, really, you know, it's really about what you gain from it and the insight that you've gained. Okay. And if you can learn a lot from looking at a particular platform and it's really informed you in terms of what a particular role does, and you know, it's had a big impact on you, then certainly talk about it. So I think definitely they have a value, because like I mentioned earlier, you could do work experience for like 3 days in a hospital, but if you don't get to do much or see much, then like it's not worth anything on its own, if that makes sense. So your experience is only worth what you've learned from it. I hope that makes sense. But definitely, you know, virtual work experiences. Universities, I think it's important to clarify, so that it's not like we categorize things. So if someone's telling me about their work experience at interview, I wouldn't go, oh, that's not proper work experience because it doesn't tick these boxes. Okay, it's really about what you learned from it. So I hope that makes sense.
Thanks, Fiona. We've had a lot of interest about work experience for medicine course. So unfortunately, we don't have time to go through this, but I'd encourage everyone to register for our next webinar on medicine, and hopefully we'll be able to answer some of those, or to email us, and Fiona will give you some more details. So I just want to say goodbye to everyone. Thank you so much for coming along today.
Fab, thanks, Jenny. Yeah, so thank you so much. We do know, as Jenny said, that, you know, lots of you might have asked questions. We will try and get back to you in the next few days to answer any questions that we haven't been able to so far. Jenny mentioned that we do have an event next week on Tuesday about applying to medicine, another webinar. So do, you know, if you haven't already signed up, do sign up to that. The week after, we're also running one on exploring healthcare courses and careers. So if you're interested in healthcare, but you're maybe not sure of which route to go, then do come along to that one as well. And we are also going to be, if you're interested in medicine, then we are going to be running an Instagram Q&A on applying to medicine, which some of our student ambassadors who are medical students are going to be running. So that's on the 27th of May, 3:30 to 4:30. So if you are on Instagram, if you've got an account, do come along and speak to them about their experiences. You can see our various social media handles along the bottom of the page, and you can also see our email address as well. So if you have got any other questions about the webinar specifically, do get in touch with us. We will be sending you a summary of this session after the event, and we'll also be sending you some links and a couple of other useful bits and pieces. So do keep an eye out in your email for those things. I don't think there's much else I want to say, but again, as Jenny said, thanks so much for attending the event. We really, really hope you found it useful. Yeah, and take care and all the best with your applications. Thanks a lot. Bye-bye.